So you have a machine that actually makes crowns right there, like your own lab, right?
We do, yeah. It's called a CEREC machine. Actually, I've been using it for over 10 years now. The way that a crown is normally done in most dental practices, even today, 21st century, go figure, is that you're going to come in, the dentist is going to drill that tooth down, you're going to get a temporary crown, you're going to be sent home for a few weeks with that temporary, you're going to cross your fingers and hope it doesn't fall out a couple of times along the way. And then you're going to come back, crown comes back in the mail at that dentist's office. They're going to try it in, make sure it matches. If it does, great, that's what you're going home with. If it doesn't, back in a few more weeks and back in the temporary. In my practice, if we're doing just a single crown or a couple of crowns, we're going to make that crown for you in the office. I'm going to take 3D pictures of what we've done and what we've cleaned up. And I'm going to actually use a milling unit that's going to make that crown. It's the same technology.
So right there?
Right there.
Now there's no impressions either? Like, for example, the gooey stuff you put in your mouth?
No.
You're just putting a wand in their mouth?
Absolutely. And so what's neat is that when I first started using this technology 10 or more years ago, it was really only meant for a single tooth or maybe 2 teeth if you push the technology a little far. Now we can image the entire mouth. When I do an Invisalign case, I don't take impressions on anyone anymore. I actually use the CEREC wand, and we'll actually take 3D pictures of the entire mouth, the top to bottom. When I'm doing my implants now, actually, I don't have to take impressions like we used to 4 or 5 years ago. I'm actually taking 3D pictures, and I can actually use my CEREC crown milling machine to mill some of the custom surgery parts and components, the surgical guides, right there in my office. And so what used to take 3 weeks even for an implant in my office, now can be done in about 24 hours. And so the technology is ever expanding, and it's a challenge to stay on the forefront of that, but that's my mission.
So some crowns can be made in one day, like while you're doing other work, they're tooths being made in the other room?
Yep, absolutely.
Right that day?
That day, absolutely.